Hi, everybody. How you doing? Again, this is Dr. John. I'm here with you, and today I've got a little PowerPoint, and the PowerPoint is really taken from Catherine's newsletter. I'm going to go over it. I like going over those and adding a few things and taking any questions if there are any. Today's newsletter was on broken heart syndrome. For some of you, that may not feel like you need it. But when I get down to the causes of broken heart syndrome, you can see that many of you could be liable to develop broken heart syndrome. And it is a real deal. It's a physiological thing. It's not just an emotional thing. As usual, Catherine's come up with some just amazing graphics. I love the cracker over there, or the cookie. And so as you can see, Takotsubo syndrome. This is broken heart syndrome, also known as stress cardiomyopathy. Cardio, of course, being associated with the heart, myopathy, myo being the muscle, and pathy being some form of illness or dysregulation. So a shape or muscular illness or disease of the heart, often called Takotsubo syndrome after one of the people that really helped delineate it. So this often, not occasionally, this often occurs when someone experiences severe emotional or physical stress. Again, it's often spoken around, since it's broken heart syndrome, around emotional distress, but it can also happen with physical distress. I've got some pictures here. It was first described in 1990 in Japan. That's accurate in terms of it being called Takotsubo syndrome or Takotsubo cardiomyopathy. I actually remember someone that I knew telling me I had to turn on Oprah Winfrey, and this was decades ago, way before the 90s, saying that there was a doctor on talking about broken heart syndrome. This doctor had pictures. He'd taken x-rays of someone's heart, just kind of as an exam. And I don't know why he was doing the exam, but an exam of someone's heart. Then a significant other to that person passed away suddenly. He took another picture of the heart. Again, a great doctor. What a brilliant idea. And it was stunning. It didn't look like the same heart. You would never have guessed it was the same human being, because these changes can happen very, very, very quickly. And again, the word Takotsubo comes from the shape of a pot. It's a pot that's used to trap octopuses. And so if you look down here at the bottom, you see this heart on my left side is larger at the top, smaller at the bottom. And that's a typical shape for a ventricle. The ventricles are the bigger. There are two atria and two ventricles. The blood comes into the atria, either from the body or from the lungs. Then it goes into the ventricles, and then it is pumped out. And the right ventricle pumps it into the lungs, and the left ventricle pumps it into the general circulation. This is really an important part of the heart. It really is going to determine how much blood flow gets from the heart into the general circulation. And now if you look over here in this middle picture, you'll see that that shape has changed quite dramatically, and you have a much larger bell shape at the bottom of this heart. That misshapenness causes a whole range of problems. Whenever the heart gets out of shape, one of the ventricles gets enlarged, one of the atria gets enlarged, that changes the electrical conductance. So there's something called the sinoatrial node, which is the pacemaker in the heart, and it's sending out electrical signals, sends them to the atria and to the ventricles, and they have to be in a very, very, very finely controlled order so that they pump in the right cadence. If they don't pump in the correct cadence, for example, if they all started pumping at the same time, all four, well, the blood wouldn't do anything. It would just get kind of squished around in there, but it wouldn't get moved from chamber to chamber or through the lungs or into the body. So it's really finely tuned electrical dance that's happening here. If the ventricle or the atria, but if one of the chambers gets out of shape, then the length of time for the electrical charge, I'll call it, to get from the sinoatrial node to the area that's going to cause the chamber to pump could be longer or shorter, and generally longer. So it's going to take longer for that electrical impulse to get there. The timing will be thrown off. In Takotsubo syndrome, what happens is that through high stress, the shape of the heart changes. It's kind of scary, really, when you think about it, that it can so suddenly change. So it causes the main chamber, the left ventricle, changes shape. It gets bigger. It weakens the heart muscle because it's stretched. Right? You don't want to stretch a muscle out. Muscles contract. They're contracting, and that's what gives them the power. It's not the stretching of your leg muscle, of the quadriceps, for example, that gives you power. It's the shrinkage. It's the contraction. Same in the heart. So if the heart muscle gets overly stretched, it doesn't have the contractile ability and it doesn't pump as powerfully. So it gets weaker and it doesn't pump the blood as well as it should. And again, this can be any age. Now, it does tend to affect women more than men, and it does affect people over 30 more than younger people. It tends to affect menopausal women a little bit more than menstruating women because the hormones are different, but it can happen literally at any age. So severe emotional or physical stress, so a sudden illness to you, not to one you love even, but to you, think COVID, think influenza, etc., can just throw your body so out of whack. It'll throw your nervous system and your hormones so out of whack that it can cause these changes. After an earthquake in a population, you'll see much higher rates of Takotsubo syndrome. And that's why it's called stress-induced cardiomyopathy or broken heart syndrome, because the heart looks broken, actually. So with classic heart attack syndromes, you get severe pressure. In fact, people say it felt like there was an elephant sitting on my chest. So if someone uses those words to me, they're going to the emergency room. A sense of heaviness, pain in the chest, hard to breathe, etc. Those are all symptoms. And most often those happen because there's a blockage, a clot or a blockage of some kind in a coronary artery. Now, coronary arteries are the arteries that bring blood to the heart itself. So as the heart is pushed out into general circulation, some of it is cycled back through the coronary arteries to get blood flow to the heart. And again, remember, the heart is a muscle. It is the most important muscle by far in your body. Anything else goes into spasm or cramps, it hurts. Your heart goes into spasms or cramps and it hurts like crazy and you will die. Really, it's something we can't afford to have happen. So here it would prevent blood from reaching the heart muscle. With Takotsubo syndrome, you can get the same sudden heart symptoms even when the coronary arteries are clear. And there are a couple reasons for that. It says temporarily enlarges and doesn't pump well. Well, hopefully it's temporary. And usually it is. Usually after a few months, it will go back into shape, but not always. Sometimes it stays out of shape. There are also treatments that can be done to help urge it to go back in shape more quickly. But again, while the rest of your heart functions normally, and sometimes even more forcefully trying to make up for this left ventricle, the left ventricle just ain't doing its job. Sometimes there's less dramatic chest pain, just as there is in many heart attacks, just some shortness of breath, some marked fatigue. Now, I was talking to a patient today, and I call that particularly fatigue under load being emphasized. For example, I have patients that if they walked, they could walk maybe halfway around the block, didn't have a lot of trouble. But if they had a briefcase or they were carrying a box or they had a backpack on in particular, they couldn't make it from the car to their house. That is a very, very dangerous sign. And that's something that you should definitely have checked out. That is not a poor cardiovascular condition problem. That's a blood flow to the heart problem in most cases. Then also cold sweats, being lightheaded, again, not spinning, not vertigo, but where it feels like the blood falls out of your head. And part of the reason it feels like that is because it does. There's just not enough blood, and it literally falls out of your head. And who gets it? About 90% are reported in cases of women 58 to 75. Several reasons for that. When estrogen levels drop, then there's less control. There are fewer buffers over the catecholamine system. Now, I did a show a few months ago on the dangers of hot flashes and night sweats. Women know that they're very uncomfortable, but they generally don't think about them as being incredibly dangerous, which they are. And so what happens is there's a rush, particularly of epinephrine, but of other stress hormones, and you don't have the estrogen to buffer them. So they kind of flare up and they cause increases in blood pressure primarily. They cause a lot of other problems, but primarily increases in blood pressure. And you get this heat, this pressure up through the chest into the head, and these flares of heat. Well, the same thing can happen with Takotsubo syndrome because the estrogen isn't controlling as well the effects of these stress hormones. Also, another reason is women at that age range are more likely to have people that they know or care about, loved ones, spouses, etc., that meet their demise, that pass away. And so you couple those and you get a much higher rate in women of that age. And often women suspected of having a heart attack. Well, if they're suspected of having a heart attack, usually they're going to the hospital. So where I see this a lot is in women who they're not quite sure. It's like, do I go to the hospital? Do I not go to the hospital? It's not quite bad enough. I don't know if it's a heart attack or not. And often that would be Takotsubo syndrome. And again, it can be fatal, but it's not usually as just like severe as getting hit in the chest with a baseball bat all at once. Now, it says most people recover with no long-term heart damage, but a significant number don't. Stress hormones, adrenaline, norepinephrine, released when you undergo a stress. For example, when you have some stressful event, almost have a car accident. Well, your body's going to pump you full of epinephrine, which makes your heart beat faster, and it's going to change pressure in the blood vessels to get your blood pressure to go up, but it also increases epinephrine, which pulls the blood out of the center of your body and puts it into your extremities and up into your head so that you can think faster and also run away from the danger. Well, all of those stress hormones, what we're talking about here, that increases heart rate, increases blood pressure, mental concentration goes up so that you can respond, but they essentially damage the heart. The heart's overwhelmed, it's damaged, the heart muscle then weakens, causing complications that are much like heart failure. They indeed are a type of heart failure in my mind, and triggers changes in the actual cells of the heart. The blood pressure causes changes, the blood flow changes, so you get true changes in the cells. The coronary blood vessels actually will constrict, and so you're getting changes in blood flow, and it prevents the left ventricle from contracting effectively. And the outpouring of adrenaline leads to the symptoms that mimic a heart attack. Now, even without Takotsubo syndrome, people that are getting a massive jolt of adrenaline can get symptoms that mimic a heart attack. For example, panic attacks. These are generally excess catecholamine storms that are affecting people. They have a panic attack. They go to the hospital. I don't know what the numbers are, but I know a very high percentage of people that present at the hospital thinking that they're having a heart attack are actually having a panic attack. I've had many, many patients where that was the case. And so the heart rhythm gets disrupted, the heart muscle gets weakened, the arteries get narrow because they're trying to increase the pressure. And the one way to increase pressure is to decrease the size of the vessel, and it impacts the blood flow. I feel short of breath. You get chest pain, heaviness, a rapid heartbeat or an irregular heartbeat, and often a rapid and irregular heartbeat. Fatigue, dizziness, particularly when you go to stand up or change position. This is a heck of a list. Catherine put this together. It's a lot of stuff. And unfortunately, there's a whole bunch more stuff that she could have put on there that she didn't. You're walking down the street and the neighbor's dog lunges at you and barks ferociously. Any number of things. But you see anything that's going to affect the heart strongly, a car accident. And this is a real danger when there's a car accident and you think someone's going into shock a little bit, they're having trouble concentrating. Often that can precede Takotsubo syndrome, a horrible argument between a couple. The heart attack rate skyrockets, and I mean skyrockets, in the hours and day after a strong argument between a couple. It's never worth it. It is never worth having that argument. Now, you can disagree, you can talk it out, but once strong emotions get involved, everybody suffers. Financial loss, you get a letter from the IRS. It's like, I know many people who've had heart problems. They get a letter from the IRS and literally they become immobilized with fear. But even good stuff, a surprise party. You walk into the room, the door gets thrown open, and 30 people scream at you, surprise! And that is just about the same as someone pointing a gun at you. It's that shocking to your system. Public speaking can do this to some people, anything that causes intense fear. So don't blow it off. If you have an experience of any of these things, and then afterwards, you do not recover quickly. So you may have a momentary sense of, whoa, this is horrible. You lose your breath. You got a little extra sensation in your chest. Okay, that's fine. If it lasts for half an hour longer, then take it a little more seriously. You can't tell the difference between Takotsubo syndrome and a heart attack. I've actually had patients, women in particular, one guy that I can think of offhand, who came into my practice. I checked their pulses. I double-checked their pulses. I listened to their heart, sent them into the emergency room, and they were either having or had recently had a heart attack and didn't know it. Not all heart attacks are obvious. I had a guy, saw him today actually, came in a little while back, and we got his EKG, and he'd gone in because he thought he had COVID. Went in and got checked out. Doctor said, hey, you're fine. I think you've got a little post-viral illness. This fatigue you're having, just a post-viral problem. Well, they sent him home with his EKG. I said, so how were all your labs? He said, oh, the doc said they're fine. I said, can I see them? And I looked at his EKG and I said, what did your doctor tell you about your EKG? He said, nothing. I said, did he tell you that you'd had a heart attack? Because right there at the top of the EKG, it said abnormal EKG. And then it listed several different problems, tachycardia, rapid heartbeat, et cetera, things that are slightly problematic. But right at the end, it said that he had had a heart attack. That's not the term they use, so he didn't recognize it, but it was a septal problem. And it indicated that part of his heart muscle had died. Now, they didn't know when. It could have been what brought him into the hospital. It could have been 10 years earlier. No telling. But he had had a heart attack and obviously didn't know that he'd had a heart attack. So it can be a little tricky here. But when you do an electrocardiogram, it can show abnormalities that with Takotsubo syndrome can look very similar to a heart attack. Now, if they do further testing, they'll be able to tell the difference, certainly. But you would need more imaging to rule out a heart attack. Clinicians, meaning medical doctors in this case, they're looking at an electrocardiogram, looking at the electrical activity, because as the shape of the heart changes, or as you get blockages in any part of the heart muscle, you're going to get changes in the electrical activity. You can look for blood tests to see if there are any signs of heart damage. Troponin is one of the key tests for that. Tests that look for blockages of the coronary arteries. And then just a simple X-ray. It's not conclusive, but it can give you a pretty strong idea if there's ballooning of the left ventricle and if there's a problem, that left heart chamber. So good to get checked out. Most of my patients have insurance. Take advantage of it. If you're not sure, go in and get checked out. The heart in traditional Chinese medicine, I'm going to take a little bit different path here. Most of the really guiding texts in Chinese medicine, there's a disagreement about when, but somewhere between 2500 BC to about 200 AD, these texts were written. And the Huangdi Neijing, or the Yellow Emperor's Classic of Medicine, again, that's one of those things that is up for debate, but certainly over 2,000 years ago. And it has tremendous detail about physiology, about health, about anatomy, etc. And when people come in and say, well, there are all these ideas, John, all these ideas on the best diet and the best time to sleep and the best this and the best that. Which one should I listen to? I said, if it were me, I'd go back and read the Huangdi Neijing. It's been accurate for 2,500 years. It's still accurate. And it will tell you how many hours to sleep at different times of the year, what types of foods to eat at different times of the year, what types of treatments to get for different conditions. And it doesn't change. What was true then is equally true now. Our bodies have not changed that much in 2,500 years. When we're looking at this, as most of you know, most of my patients, I do integrated medicine. Now, a lot of people use that term in a way that I don't think is very valid. Catherine and I do integrated medicine, and it's in a way that I consider more valid, but not perfectly valid. Neither of us has a medical license, so we can't give drugs even if we want to, and we can't do surgery. However, we do a lot of Western medical laboratory testing, etc. And then we do traditional Chinese medicine as a diagnostic tool and for treatment. I think that the blend of those creates a magical web of possibility. Both modern medicine and traditional Chinese medicine can agree on two functions of the heart. The cardiovascular system makes up the heart, the blood vessels, and in the cardiovascular system, we're going to include the blood, that red substance that is getting pumped through your blood vessels by the heart and by the arteries. In Chinese medicine, and actually this is coming more and more and more to be a Western concept also, the Shen, which really roughly, again, these are pictograms, so they never, ever can be translated 100% into English, but they roughly translate to the mind or the spirit. And I think both of them are accurate because the mind and spirit go together, and one or the other I find to be, in my mind, a little more accurate. Some people would call this the real I, that this body is something that we have, but the Shen is the true I. When you say, what am I? Then you'd be looking primarily at the Shen in some people's perception. I'm not saying that's correct or not. And so it's what perceives ourselves. What is it that's aware of you all the time? All the time, every moment that you can think of, every moment that you can't think of, while you're awake, while you're asleep, there's something that is perceiving you. It's perceiving your moods. It's perceiving your emotions. It's perceiving your cognition. It really precedes, but it's really more a matter of it being the context for all. And so that is included in this idea of the heart in Chinese medicine, the Shen. The heart houses the Shen. And so our mental and emotional state depends on the Shen. It's our ability to think, to recall memories, recognize feelings, show feelings, understand signals from the five senses, we would say. In some cultures, they talk about more senses, but I'll go with five. That's fine. And so this is included in the idea of heart. If the pathology of the heart, if the physical heart is damaged, then the Shen will also have problems. So I'm in the middle of teaching a 15-week cardiovascular course, and I speak about this week actually problems with what's called a heart yin deficiency. So this is a deeper level of deficiency, and in that state you get a lot of anxiety, insomnia, etc. This is when the heart is rather disturbed, actually. A lot of these functions of the Shen correlate to the functions of the brain in Western medicine. The brain receives stimuli from our senses, decides what's important for us to notice. It can recognize emotions, but it's really the heart. If you'd measure the electrical activity of the heart, it clearly feels the emotions. It responds to these stimuli. The electrical energy of the heart can easily be measured at 15 feet. It can be measured with more sophisticated instruments at 50 feet. And there is a lot of thought that it can be measured at much greater distances. You ever wonder why a dog likes certain people and doesn't like other people? I think the heart has something to do with that. I'm making that up, but I like it. So it's really this heart mind is what the term is Xin, Xin, and it translates quite literally as heart/mind. In the Chinese way of thinking, they are inseparable. You cannot have a thought that doesn't affect your body. That's why lie detectors work. You can't have something happen to your body, a sensation that doesn't affect your mind. So they are intimately connected. So when you have a horrendous, a difficult, a painful emotional experience, it will affect your body always. In this case, with Takotsubo cardiomyopathy or broken heart syndrome, we get a situation where a stress-induced condition causes ballooning of that left ventricle. There's tons of new research on this. I read a lot of research, and I probably read 4 or 5 studies a week looking at the causes of dementia, and particularly about how coronary heart disease and dementia are so strongly linked. And so there's a 45% increased risk of dementia or cognitive impairment. And cognitive decline can be accelerated by 66% when there's coronary heart disease. And I see this with patients, and the research is quite clear. We're looking at the positive correlation. And by positive, I mean, as one goes up, the other goes up. I don't mean positive as in good. And so we're seeing a positive correlation between mental health disorders and coronary heart disease. And so dysfunction and dysregulation of the autonomic nervous system, that's the autonomic is the automatic nervous system. It's the part that's run mostly by the vagus nerve and that you don't think about. You've got the sympathetic nervous system, and you've got the parasympathetic nervous system. And so the sympathetic, it's going to allow you to run. It's going to allow you to do things, whereas the parasympathetic is going to allow for digestion. It's going to have you breathe. You don't have to think about those things. And then we look at the hypothalamic pituitary adrenal axis. Hypothalamus in the center of the brain is constantly reading and reacting to physical, emotional issues in the body, including chemistry, a lot of body chemistry. It's sending messages to the pituitary. The pituitary then sends messages out to the different organs of the body, telling them to be more or less active. And part of that axis is to the adrenal system, which is intimately involved in stress, also intimately involved in lowering inflammation. These dysregulation and dysfunctions are found in mental health disorders. And again, this isn't conjecture. This is very well proven now. So heart rate irregularities, inflammation, increased platelets with inflammation, and platelets are clotting mechanisms. So when you have dysfunction and dysregulation, you're going to have more inflammation. And with the increased inflammation, you're going to have higher platelet numbers. And that's going to make you more prone to heart attacks and strokes. Catherine threw some points in here for you. These are all points that you can do acupressure on. They're really powerful acupuncture points. So heart 8, very powerful point, Shaofu. If you open your hand, make a fist. It's where the little finger falls on the hand, right here where these two large knuckles are. It's just toward your body from those. And if you press on those, you'll be clear that there's a point there. And so you just want to massage that, and that's to clear heat from the heart and the small intestines. In Chinese medicine, there's a 5-element correspondence, and each of those elementary correspondences will have more or less heat or cold, more or less growth or death, etc. And so the heart and the intestines are the fire system. So there's a lot of fire in the heart and in the small intestines. This makes them particularly prone to inflammation. Small intestinal inflammation is one of the biggest scourges on our planet, as is heart inflammation. You take those two out and you get rid of about more than half of the causes of death in our culture. So this is a great point. Those of you that are parents, if you've got kids that are, they just can't go to sleep. They get really excited, overly excited. They're kind of uncontrollable in the evening. This is a great point to do on them. Find a way to make a game out of it. Have them do it to you. You do it to them. Do some drawing, however you do it. But this is a great point to have some fun with. This next point, Shen Men, Shen being for spirit, and Men is gate, is the most common translation. So this is the spirit gate. Sounds like a pretty powerful point. And this one, again, is very easy to find. It's located in the wrist crease. Above, it means this way, the pinky finger. And you find this bone right down here. It's kind of a pointy little bone. And right at the base of that is where heart 7 is. Again, that's a great place to put a little gentle pressure. If you move your finger around or your thumb around, you'll find a very, very gentle pulse there. There is a blood vessel underneath there. And with this one, this is a great one for contemplation and meditation. So you take long, slow, and I've talked before about the 4-7-8 breathing method, but any breathing method that works for you, where you're taking very slow, long, full, deep breaths down into your lower dantian. So the air fills the area down below your navel. Hold it, let it out. So you want to put your feet flat on the floor. And there's a point and this was in a couple of weeks ago, there was I think last week actually, where we were stimulating the point kidney 1. So if you take a small tennis ball or a golf ball and you put it under the foot right behind that row of bones, just down from your toes, and you put it right in the center beneath that arch, and you gently press that while you do heart 7, that's going to have profound effects. There's something called a heart-kidney disharmony. And when you see people with mental, emotional disorders, bipolar would be kind of extreme to that, but kids arguing with their parents and parents with their kids, or arguments among spouses, there's usually a heart-kidney disharmony. And it's like the ships are passing in the night. They're not really communicating. They're just, arguing. The combination of heart 7 with kidney 1 is a brilliant, brilliant combination. Here's another spirit gate. Great to do on kids. Again, fabulous. Good for stress, anxiety, insomnia. You can even do it with for some motion sickness, although there's some better points for that. So anyway, very powerful. This is a better point for motion sickness. This is pericardium 6. Again, the palm side of the wrist, about 2 thumb lengths from the crease, 1, 2, and right in there. Some of you have seen seasick bands. The idea for those comes from this point. Usually the seasick bands don't go deeply enough unless you give them a little added pressure. But this is a very powerful point for seasickness, for car sickness, etc. Also to reduce anxiety. It reduces stress. It reduces irritability. I've had patients come in who had significant arrhythmias. They're missing 1 beat in 4 consistently over a few minutes. I will massage pericardium 6, and often the heart goes right back into rhythm. You can do it on yourself. If you find that you're having heart arrhythmias, atrial fibrillation, etc., this is a great point to work on to stimulate while you're doing some breathing exercise. Very, very powerful point. The bottom line, you got to take care of yourself. As my mom used to say, Johnny, if you don't chew your food, who will? I thought that was a little weird when I was a kid, but it started to make sense later, in that they always tell you if you're on an airplane with a kid, put your mask on first, because you can't help the kid if you're unconscious. So take care of yourself during stressful situations. If you have a strong emotional thing that arises for you, anything from a business problem to a personal problem in your family, horrible event in your family, someone is sick or passes away, make sure you treat yourself and or get some help with the treatment. You've got to calm the mind, you got to calm the heart as quickly as possible, because the longer the problem continues, the more severe it is. Any questions? No, I bored you all. I put you all to sleep. Oh my God, you got to start asking questions. Or I just think, I mean, I know I can be boring, particularly if I do a PowerPoint rather than just talking, but I'm going to think I completely put you all to sleep unless you start asking some questions like, what's important about July 6th? Okay, I'm not going to answer that. That's up to you. But don't hesitate to ask me some questions. Anything, Catherine? We good? Okay. Well, I can't tell you how much I appreciate you tuning in. This is a real high point for me, just being able to sit here and, talk and share some ideas with you all. And I'd love for you to share some ideas back. So until next Thursday, same bat time, same bat channel. Be happy, be healthy.